I'm here to represent the Multi-Municipal Energy Working Group. We were actually to have the chair, Tom Allwood, here as well. He sends his apologies. The meeting schedule changed. He was involved in a conflict. So,
Bill, can I interrupt? I think we've got a presentation, your presentation to put up here.
Yep.
Sorry, we'll just get that going so we
Wait till
can
it gets this
follow through on it.
kind of small to see, but do you perhaps have it with you, or is it?
It is,
We have a lot of it in joint form in the letters.
Okay, well, anyhow, well, we'll do what we can, and
yeah.
I'll try to speak few words to people, but not too bad. Okay. So thanks very much for inviting me. So I guess first off, I begin to say, why is the Multi-Municipal Energy Working Group here? I'm just going to call it the working for ease from this point on. Basically, the working group is composed of elected officials from a number of municipalities, plus a council-appointed representative from a number of municipalities. And the terms of reference of the working group is that it's to draw together representatives from the different municipalities to just share and discuss best practices related to concerns about energy generation and storage infrastructure. One of the things that a municipal group does is it receives delegations from citizens. And a citizens delegation to the group requested clarification for the association between wind turbines and public health. So in the course of finding out the resolution to that, correspondence back and forth to the Associate Director of Health Protection, Policy and Partnerships branch basically came back and told us what this group already knows, that according to the Health Protection and Promotion Act, it's really the medical officer of health who can make a health hazard determination. And so that's nothing new. So that was the official position that came back. Now, the group noted that in February 2013, at that time, the medical officer of health, Dr. Hazel Lynn, accompanied by Dr. Ianera, reported an association between wind turbines and health. And as described by CTV News at that time, Dr. Lynn stated that more public health research is needed in the wind turbine area. And this delegation from the working group, resulting from a motion from the working group, is to request that subject to be revisited. So if we look at the next slide, why it matters to act now, specifically now, because the IESO, or Independent Electricity System Operator, issued in December documents basically saying that their plan is to develop 5 terawatt hours of new electrical generation in the fairly short term between now and 2030 to meet a growing demand on the electrical system. And they proposed that this will mostly be supplied by repowering existing wind turbines that are coming to the end of their lifetime in that period of time. Now, they suggested in their documentation that repowering wind turbines would be just done on their existing footprint. Just take it on one, put it another one, same spot. Realistically, to gain the generation that they're looking for, it needs increasing the output by each turbine by 168%. So that's going to mean bigger turbines, taller towers, bigger rotors, higher output for each. Now, most of the turbines that will be repowered are turbines that were installed before the current setbacks were issued. We have current setbacks of 550 meters, and we have current noise setbacks. Most of the turbines that were installed were before those regulations were in effect. So if we carry on, please. What will this mean to citizens? Just if we look at specifically the example of the Enbridge Underwater Array, we could look at almost any of them, but there, 41 out of the 110 turbines are located at a spacing of less than 550 meters to the nearest resident. And if you look at the homes, 52 of the homes in the area have the closest turbine less than 550 meters, as close as 444 meters. Some have 2 turbines closer than 550, and up to 37 turbines within 3 kilometers. That's a lot of turbines. Many of the houses in that array and others have the existing noise exposure greater than allowed by the current regulations, because those regulations went into effect after the turbines were installed. And what we have is that an already bad situation will become worse as these turbines get replaced with bigger turbines, larger rotors, taller towers. The ISO has been having consultations with the suppliers, and they basically, some have come back and said, you know, we can't meet the new regulations. You have to grandfathers will put up the new stuff under the old regulations. So this is the position that's being looked at. So what? What are the consequences? If we look at the next slide, please. So just as a few examples, looking again only at the Enbridge Underwood grade, a male in his 50s, no previous issues of concerns, living within 485 meters of the nearest turbine, with 13 within 3 kilometers, stood up at a meeting, said, you know, I have leases for turbines, they don't bother me. Less than a week later, that gentleman had sudden cardiac arrest and passed away. His family grieves. Next one, a female in her 30s, no previous issues, lives within 530 meters of the nearest turbine, has 35 within 3,000 meters, died suddenly, cardiac arrest. Male in his 60s, no previous conditions, 518 meters the nearest turbine, 18 within 3,000 meters, again, cardiac arrest, passed away. A female in her 50s, no previous conditions, lives within 453 meters of the nearest turbine, 26 within 3,000 meters, had to leave her home, had to leave her work because she was making critical errors at her work that could impact the health of others. Went away, she was fine. Went back to her house, again, sleep deprivation, nausea. A male in his teens was an infant when the turbines were installed, lives within 500 meters of the nearest turbine. He has 12 within 3,000 meters. Met his father at the hospital up here. Father says, you know, we have son here, terrible, terrible headaches. Medical staff keep trying to assess what the problem is and they can't find it. It's interesting. I could go on for time, stop there. If I look at current research, what does current research show? Now, you have a copy of this, basically a print from this journal in your package, but just to look at very briefly a few points. What this research showed, it was presented to actually the International Wind Turbine Noise Conference in Dublin, Canadian Acoustical Conference in Montreal, and documented in this journal, basically concludes that annoyance can be reliably predicted by an objective measure based on simple to measure acoustic parameters. That objective assessment of annoyance matches the subjective assessment that residents have. Residents say, I'm annoyed, I don't know why. You can look at the assessment and say, there's a match. Now, this is important because it shows that annoyance is linked to an acoustic condition present when the turbines are operating, and it's not a product of just visual triggers or attitude, which is often said. So you can sort of look through, I won't go through in detail, we can't in time. But basically how the research was conducted, there were samples collected, continuous samples collected for an 8-month period. At the same, this was at a home, 537 meters from the nearest turbine. At the same time, the residents logged times that they said, it's really, I have a bad today. After the data was collected, the acoustic samples were looked at the times when the residents identified the concern. And this sort of came out and said, oh, there looks like there's something here. There's a set of conditions that are matching here. Went and looked at other arrays where people were expressing their annoyance. We looked at the data, same conditions coming out. So this sort of looked at a hypothesis. So, but people said, oh, well, it's probably just the wind, isn't it? So we went back and we did another set of readings for another 6 months. And here we looked, we said, put a sample again back at the home, 537 meters away. We also looked at a home 6 kilometers away from the nearest turbine. Same wind conditions, same environmental conditions, okay, other than no turbines. And what we found was it's not the wind, because distant from the turbines, that condition doesn't exist. Close to the turbines, the condition that people identified in lines exists. So What happens if the turbines are repowered? If we look at the next slide, please. What it basically says is that, I won't go into the detail, you can sort of look in the journal, but what it shows is that the annoyance criteria will get worse with bigger turbines. Because bigger turbines with a larger rotor have a larger fraction of the sound and the low frequency. What we're seeing is that where the sound that will say we normally consider what we hear, if that sound is not varying the criteria is basically the sound that we hear is not varying very much. Okay? But what we're finding is that the sound that people effectively is not measuring is varying significantly. And that's where the annoyance exists. So what is measured isn't varying. What isn't measured normally by the criteria that we base our criteria on is varying. And as I say, the turbines with larger rotor diameter have a larger fraction of the noise in that low frequency spectrum. They will come back and tell you, oh, these are quieter turbines. What it's done is it's pushed the energy into the low frequency. Repowering is going to increase the objective measure of annoyance. And the bottom line is things that are bad now will get worse. So what can the Board of Health do? If you like, this is the ask of the deputation from the working group. There's three parts, basically. The first is a request that the Board of Health look at a rigorous review of reports of annoyance, adverse health consequences, or deaths, and correlate it to the residents' proximity to the nearest turbine. We can share deputations for where residents are showing they're annoyed and so on. The second part is to look at the current research that shows an objective criteria. An objective is measured, okay? A measured criteria, and share those review findings from your review with the Chief Medical Officer of Health. The Chief Medical Officer of Health documentation, which was just reaffirmed this year, says a weighted sound is the gospel. If we could share this, research is showing that there's a need to change the way of looking at it. And as necessary, if your review finds that, the third request is, because the Medical Officer of Health has the ability to issue a health hazard order, before the ISO comes out and says, we're going to do this, is that the Medical Officer of Health could say, you really need to meet the standards. You're not meeting the standards. Now we have turbines that are not meeting the standards, have not met the standards for 17 years of operation, okay, that are still operating, because repowering is going to get things worse. Now, realistically, because the working group is composed of elected officials as well, they recognize that the Board of Health has many priorities. Where does this fit into the Board of Health priorities? From where the working group sees it, the working group sees that there's many current issues facing the Board of Health that are arising from basically a general public impression of despair, feeling of loss of hope, opioid addiction, overdoses. Certainly know this is something you're facing, Nancy, but it's arising from despair. Citizens' issues of, rising costs, inflation, people living on the street that can't bear in a house. They don't have any hope. Healthcare professionals are sort of burning out because they say, we can't deal with it all. Many of these issues are determined by an on the street impression that those in authority don't care. People on the streets, those in authority don't care. What the working group is suggesting is that the actions that are suggested, those three actions, can be accomplished with a relatively small expenditure, and they will demonstrate the Board of Health does care and does want to prevent a bad situation. It's already bad now from getting worse. So, and the working group believes that any action that can generate hope has just an overflow effect that says, well, the people who care really are trying to help. So it can help address. So thanks very much for your attention. Certainly the working group will look forward to the response to our deputation, and it can be sent to the secretary of the group behind us. So if you have any questions or comments, I would try to do what I can to answer your questions. Thank you.
Thank you. I will look around the table and online. Does anyone have questions? Go ahead.
Thank you, Madam Chair. I just wonder if Dr. Vera has any comments to make in terms of the requests that have been made by the group in terms of how public health might follow up on them.
Certainly, for you, Madam Chair. I wonder if we can just, Carrie, if we can hook up my computer, the battery might die for the whole meeting. Thank you so much for the delegation. Obviously, I worked on wind turbines over 10 years ago, and I do have quite extensive knowledge about the subject at that time. And since it's worth mentioning that the study that we published at that time had found evidence level 4 and 5. And forgive me getting technical, the evidence is between 5 to 1. 1 is the strongest, 5 is the weakest. So the level 4 and 5 is very weak. We did a systematic review, not meta-analysis. And the difference between them is meta-analysis when you have the evidence from the Holy Grail clinical trial. Clinical trial when you blind people to the intervention and you measure the outcome if there is intervention or no intervention. Obviously, in wind turbine, it's impractical to blind people that they're living beside wind turbines. So we might never really see the level 1 strength, but even 2 and 3, which is case control studies, cohort studies, technical term for robust design and for a study have not been done at that time. And our call was for future research. And my understanding, Public Health Ontario had looked into the evidence in the years after. So that research generated interest, and Public Health Ontario is the scientific arm for public health in the province. And they are at arm's length from the government. And their conclusion, like you rightly said, it's a nuisance. And the word nuisance in this area of literature means it's not a health hazard. It cannot translate into a health hazard where a medical officer of health can utilize in section 13. I'm going to jump to one of the asks that you mentioned to consider section 13. According to the law in Ontario, it would not meet the bar. Even if somebody wrote that order, the party receiving the order can appeal it. There's nothing 100%, but close to 100%, it will be declined as an order. So that's not a practical point in the next steps. And since I jumped to the next steps, I do have probably the most practical one is to connect the group with Public Health Ontario. So you have a call for certain data and evidence, and if you have a meeting with Public Health Ontario and we can arrange with that, we can facilitate it. That will be the next best step if I go to the bottom line. But to be complete, just to go through what you presented. So health hazard is not something that we can look at. It's annoyance or nuisance. The article you referenced, I have to stand by the science. I can wear my epidemiology hat or medical officer of health. I have to stand by the science. It's published in .com, means it's the least credible source of information. When we look at evidence, we look at .edu, educational institution like Harvard would have their URL, edu, .government, gov, also credible. .org is less credible than government, but since 2016, my understanding, commercial endeavors can buy an organization URL. So it's similar to commercial. So again, if you want to put it on a level between 1 to 5 that I referenced earlier, it barely would meet the level 5 if it is accepted. Level 5 would be one scientist making their study based on case study of their anecdotal evidence and publishing it in educational paper or website where it's peer reviewed. I don't believe this article meets it. I could be wrong, but again, if the next step is to present this evidence to Public Health Ontario and ask them to evaluate it, that would be the most appropriate. One of the asks was to the Board of Health to conduct that research. One, it's not, so the article itself can be evaluated by Public Health Ontario and to the satisfaction of the group to realize how much evidence there is in it. I struggle with the slide that has wind turbine and opiate as public health problems. Both opiate is a public health problem and it's claiming many lives and it's well documented. There is no argument about the causal effect. Wind turbine, again, that causal effect that it's causing disease or even death needs to be established. I know there's many anecdotal evidence that you share, but this is public knowledge. It's not even scientific anecdotal evidence. And again, I should have started by this, but I'm going to close with it. I realized how disturbing to life it is for people who are living in close proximity to wind turbine. And there is no question about it. The issue is it for this board, is it a local public health problem or not? Right? Because you mentioned the standards, they're not being met. Those are not local standards from the Board of Health. They're either provincial or federal. And, you know, can we advocate to support your cause to call on the legislative or on the jurisdiction responsible for it to look into it? We could, but it's not within the Board of Health legislation to say that the wind turbine company, you're not meeting standards. Unless it becomes a health hazard. And for it to become a health hazard, we have to go through the Public Health Ontario evidence to say to the Board of Health, yes, that's for all of you in Ontario to deal with. I'm not sure if I disappointed you
No, okay,
a bit
no,
or a lot.
No, that's your position. I understand. I don't know if I can respond. Is that through Jerry?
Yes,
Thank you.
information, so.
Okay, no, just for information. No, thank you. I guess the concern is that there will be, you know, if we do not act, there will be repowering of wind turbines that don't meet the standard with new turbines, even bigger. The things will get worse. Now, provincially, we haven't, you know, we have continued to allow them to operate for 17 years without demonstrating they meet standard. And to put in bigger ones without meeting the standard. I guess from the perspective of a different municipal group, that different municipal group sees that is a concern. That's all I can say. You know, I'm speaking on behalf of that municipal group. I'm trying to funnel all of their information through me. That, you know, the group really is concerned that we are not meeting standards. We have not met the standards. You know, the published information, as you say, this is in a journal. You know, it's previously documented in the Canadian Acoustical Association journal as well, actually, which is a peer-reviewed journal. You know, as well as documented in the proceedings of the Wind Turbine Noise Conference. I didn't give you that other than there's references, but recognize the issue. So I thank you for your comment.
Just, I think, as Dr. I think rightly pointed out, and as I think probably Bill will acknowledge too, this is a matter of provincial jurisdiction and authority where the province has to set out a standard that's acceptable and enforce that standard. Certainly in my own experience, the province has failed to do that in many cases in this regard, certainly in my own community. But Dr. suggested connection to be made with Public Health Ontario. This group, I really think, given that it is a matter of provincial jurisdiction, where whatever we do here or say here, you know, we can't tell the province what to do. They tell us what to do. So I think the best thing to do is to make that connection. And I appreciate Dr. making that suggestion. I think if that is something that can be actioned between you, Dr. and Bill, and the multi-municipal group, I think that would be a great result from this discussion. So hopefully that's something we can happen. I'm sure.
Excellent. There is no other question. Mr. Evans.
What's the mission of the energy group?
Well, basically, as it described there, it's to purpose is to draw together representatives of different municipalities to share, discuss, and advocate best practices and other means to address mutual concerns regarding energy generation facilities and storage infrastructure to all relevant government ministries and agencies. So basically to advocate best practices, to receive concerns, to look at the information, to address best practices. So that's the mandate under the under the terms of the, as you were aware, it meets under the control, the auspices of the Municipal Control Act. As a municipal organization.
Is Mark Davis still part of the group?
Mark is a citizen representative for the municipality of Aaron Alberson.
Okay, I think that's it, and thank you very much for coming today, and I'm sorry if we held you up. We
No, it's good. You
had
had
difficulty here.
as you say, you had other priorities. No, we had to come here because we corresponded with Public Health Ontario. And they basically, their response to us was, we need to go back and talk to our medical officer of health. So that's why we came here first. So, and we would have certainly appreciate if you can facilitate for us to go back and talk to them again, but they sent us to you.
Most certainly, through you, Madam Chair, most certainly, I'll be more than happy to be of service and facilitate that meeting and even stay in the meeting and interpret whatever you want to convey to them and whatever they convey back.
Thank you very much.
Okay, thank you. Ken?
So we can't, direct staff because we don't have a quorum at this point.
No,
But-
this
but-
meeting is officially over, actually.
But as a member talking to the chair, could we put on our agenda next month? Just, an item, don't you listen to this, I can't. Could we put an agenda item just to close the loop, just so that we can, officially receive the report? And if there's questions or thoughts or process, rather than just what's gone, like just tidy it up and close the loop. And if there's direction to staff, then we can do it then, but we can't do it then.
So in my mind, that will fall under unfinished business, and that would come back
Sure.
next month.
Or correspondence or something, just for, and it's not to, yes, your guidance.
Excellent.
Thank you.
Thank you, Mr.
Thank you
Potter.
very much. Thank you. Thank you, Winter.
Yeah.
Where is yours?